The main arteries supplying the head and neck ascends from the aortic arch. These vessels are the brachiocephalic trunk, left common carotid artery, and left subclavian artery. In the supraclavicular region, the brachiocephalic trunk bifurcates into the right common carotid and right subclavian arteries. The common carotid ascends within the carotid sheath up to the level of the upper margin of the thyroid cartilage and then splits into internal and external carotids. External carotid artery supplies the exterior of the cranium, while the internal carotid artery supplies regions within the cranial cavity and the orbital cavity as well. The internal carotid has no branches in the neck. It enters the cranial cavity by carotid canal of the pyramid of the temporal bone and branches out. The ophthalmic artery appears here, anterior cerebral artery, here it is, and the middle cerebral artery. Cerebral arteries give a lot of branches to supply the anterior 2/3 of the brain. We are not going to discuss them in this section. While the ophthalmic artery enters the orbital cavity and springs out the supraorbital artery, supratrochlear artery, lacrimal artery, and superior medial and superior lateral palpebral arteries. The palpebral arteries anastomose inside the upper and lower eyelids, forming the superior palpebral arterial arch and inferior palpebral arterial arch. The external carotid artery passes upward and forward and inclines backward to the space behind the neck of the mandible. Let's review the branches which appear here. First of all, the occipital artery. It supplies the digastric, stylohyoid, upper part of the sternocleidomastoid and trapezius and splenius capitis. It also gives the posterior meningeal artery to the dura mater and the posterior cranial fossa. The auricular artery supplies blood to the scalp, posterior to the auricle and to the auricle itself. The facial artery, which arises here, supplies structures to the superficial face, springing out the submental artery, inferior labial artery, superior labial, transverse facial, dorsal nasal arteries. They are not marked here. In the medial angle of the eye, it terminates as an angular artery, which anastomoses with the ophthalmic artery, a branch of the internal carotid artery inside of the orbit here. Lingual artery arises just below the facial artery. It ascends to the tongue between the suprahyoid muscles and supplies them, as well as the muscles and mucosa of the mouth. Superior thyroid artery is the next branch. It provides the blood supply to the thyroid gland and gives branches to the larynx and laryngeal muscles. The terminal branches of the external carotid artery are the superficial temporal artery, which supplies the parotid gland and scalp, and the maxillary artery, which supplies the jaws, teeth, and the deep region of the face. The branches of the maxillary artery are numerous, as well as the served area. These are the middle meningeal artery, accessory meningeal artery, inferior alveolar artery, posterior deep temporal, medial pterygoid, mesenteric, lateral pterygoid, buccal, descending palatine, superior alveolar, anterior deep temporal, infraorbital, pharyngeal, Vidian artery or the artery of pterygoid camel, and sphenopalatine artery. The last one is the terminal branch of the maxillary artery. The subclavian artery, crossing the base of the neck, participates in blood supply of the muscles and organs of the neck as well. The vertebral artery, which arises from the first part of the subclavian artery, runs cranially in the transverse foramina of the cervical vertebra. It joins the contralateral vertebral artery, forming the basilar artery. The thyrocervical trunk is a short vessel arising from the first part of the subclavian artery. Here it is. It divides into inferior thyroid artery, suprascapular artery, and transverse cervical artery. The transverse cervical artery crosses in front of the phrenic nerve and scalene muscles and passes between the divisions of the brachial plexus laterally, where it splits into a superficial branch, the superficial cervical artery, which supplies the lower part of the trapezius, and the deep branch, the dorsal scapular artery, supplying other muscles of the neck. From the second part of the subclavian artery, the costocervical trunk begins. It bifurcates into the superior intercostal artery and the deep cervical artery. The last one runs up between the semispinalis capitis and semispinalis cervicis, as high as the C1 vertebra, and supplies the deep prevertebral muscles.